This segment is brought to you by MDS, Molecular Diagnostic Services.
Dr. York, thank you so much for joining us on Living Your Best Life.
It's a pleasure, Maria. Thank you for inviting me.
So today we're going to talk about the coronavirus, and we're going to hope to shed some light. Okay, the first thing I think that's important is for us to firstly define it and tell us what coronavirus is.
Coronavirus is a small RNA virus that's been around for many years. To date, there are 7 different coronavirus strains that have been identified. 4 of them are involved in causing the common cold, so one recovers from that infection very readily. However, there have been outbreaks of more pathogenic strains, more disease-causing strains of coronavirus, such as SARS in 2002 and MERS, Middle East Syndrome virus in 2012, and more recently the SARS coronavirus 2 virus, which causes COVID-19, the disease that we are concerned with at the moment.
So what are the symptoms involved when someone is infected with the coronavirus?
They typically flu-like symptoms, early onset flu or viral infections. There'd be a fever, sore throat, shortness of breath. But the virus can also progress and infect the gastrointestinal tract, and you could get diarrhea and muscle aches. Those would be the early symptoms of the infection. However, these are common symptoms of viruses. One needs to have either come from a risky area or be exposed to the virus in a risky country, or being exposed to someone who has the infection or is suspected of having the infection, or if you were a healthcare worker and you were in close contact. So those are very important points to remember, because the symptoms are common viral infections, common cold infections, but you need to have the risk factors to really act on it.
How does it spread?
As it is initially a respiratory viral spread disease, so it's through droplet infection, people sneezing, coughing in your saliva. So the theory is that within 6 feet to 1.8 meters, you are at risk of infection person. Because it's in high concentrations in the saliva and other respiratory secretions, it can be on surfaces. So you could get it indirectly touching a surface, a handrail, a teddy bear that's been touched by someone infected with the virus, and then your hands could be in contact with your mouth or nose.
So I'm going to put you in a little bit of a tough situation, and I'm going to ask you about, in your opinion, do you think that this virus could become a deadly pandemic?
I think fortunately we've got the examples of SARS in 2002 and MERS. They were both a lot more pathogenic, a lot more deaths occurred from SARS in 2002. A little under 10% of the people infected died. MERS was a little bit more infectious. However, in the case of SARS, it started in November, it was identified in November, and by the middle of 2003, already the spread had reduced. So our figures suggest that the virus is about a little under 3% of those infected die, and they tend to be the elderly and immune suppressed. So I think it's most likely going to follow the profile of the SARS. However, one always needs to be cautious, because in a certain population where there might be more immune suppressed people, it might spread a little bit faster, and it might be a little bit more pathogenic than in another population.
As South Africans, do you think we as a country are equipped to deal with an outbreak here?
I think places like the National Institute of Communicable Diseases, they have done a very good job. The Department of Health have also been proactive. They have sent out notifications. They've already got plans in place. They already have the test, and they have been doing some testing. So I think they need to be complimented on their job. However, we need to be vigilant and follow the guidelines of the rest of the world in reducing the risk of the virus getting into the country. So one needs to be very cautious. If there are infections identified, isolate them and follow the guided procedures.
Is it advisable to be traveling in this time?
It's a good question. I personally would advise against traveling to risky areas. You want to try to reduce the risk of exposure.
Dr. York, if somebody suspects that they may be carrying the virus, what is the logical steps that need to be taken?
If they are presenting with the flu-like symptoms and they have been exposed to the virus, either from a person infected or from an area that is at risk, then they should go to their healthcare worker and notify them that they have been possibly exposed and they are presenting with the symptoms. Their healthcare provider would then notify the NICD, who would then request a throat swab, and the NICD would do one of the tests they would do would be the molecular test. That's a test that we also specialize in. The NIC are prepared. We have also recently acquired the test, so we can also offer it. So we anticipate that we might be able to work with the NICD to offer this testing to the public as well.
Perfect. Well, thank you so much for joining us today.
That's our pleasure, and thank you.
Thank you.
This segment was brought to you by MDS, Specialist Molecular Diagnostic Laboratory, focusing on human and veterinary diseases, women's health, DNA paternity, and wellness. Contact MDS on 031 267 7000 or visit mdsafrica.net.